Hi, I'm Taylor Duncan, and today I'm going to be demonstrating how to perform tracheostomy care. The first thing I'd want to do is introduce myself to the patient and let them know step by step everything that we're going to be doing. You'd also want another nurse here to help you, just to stabilize while you're changing out the old dressing and cleaning around the skin. Where I'm doing the video myself today, it'll just be me. And then I only had one dressing in my kit, so I'm just going to pretend that I've already taken the soiled dressing off and I'm going to be putting a new one on. And then after I introduce myself to the patient and let them know what we're going to be doing, I'm going to help them into semi-Fowler's position. And then I'm going to go ahead and perform my hand hygiene and open my tracheostomy care tray. Grab my sterile gloves, not touching anything else in the tray. Okay, and I go ahead and dispose of my packaging there. I'm going to go ahead and take my drape out and put it around my patient, just in case we drip anything. We don't want it to get on them. And then the next thing that I'm going to do is I'm going to remove the inner cannula and I'm going to place it in my basin. I would be using solution of hydrogen peroxide and sterile normal saline, and I'd use the same amount of both. Before that, I just want to remove everything from my tray that I don't need. And again, this is my sterile field. I'm going to take out one gauze pad that I'm going to use later, and then my ties. So I would be pouring my hydrogen peroxide and my normal saline in here. I don't have the solutions in my kit, so we're just going to be pretending that I'm pouring it in there. And I'm going to go ahead and remove the inner cannula by unlocking it, and I'm only going to touch the outside and carefully pull it out. And you'd want to have the other nurse there holding it stable. Depending on what type it is, it's either disposable or you can clean the inside of it. So today we're just going to be cleaning this one because I don't have another one, and we'll clean it and then put it back. You're going to provide suction as needed for the patient as well. So after I've taken out the inner cannula, I'm going to go ahead and grab some of my swabs here, and they would be in the solution as well. And I'm just going to clean around the skin. And once I used one swab, I'd go ahead, toss it, and grab another clean one. And I'm going to go down around that as well. And then you can use a gauze pad as well. It would be in the solution, and you would go ahead and again just clean around where you've cleaned with the swabs. You can use either the gauze pad or the swabs. And then I'm going to go ahead and grab my clean gauze pad, and I'm just going to dry the patient's skin around where I just cleaned. And I would toss that as well. Then I'd go ahead and I would clean my inner cannula, and I'd be doing it in my solution, and I have my brush here that I'm cleaning it with. Once that's been cleaned, you're gonna go ahead and put that back. So again, I'd have my other nurse here to stabilize, and I'm just gonna go ahead and hold it, and I'm going to put it back and lock it into place. And continually just making sure the patient is okay. Next, what I'm going to do is I'm going to replace the ties. So coming back here, I'm just going to untie, and I shouldn't have tied it in a tight knot. So give me just a second to get this untied. And again, we'd have our second nurse here holding this site just to make sure that it's not moving at all. Okay, so once I have my ties undone, I'm gonna go ahead and remove the old ties. And again, you'd just be holding this securely. Okay. And I'm gonna go ahead and put my new ties in. It's a little harder when you don't have a second person there to help you, but just make sure you're holding it in place. Okay, so once I have my ties in and the trach is secured, I'm gonna go ahead and I'm going to tie it in a loose knot on the side of the patient's neck. For this patient, obviously I need to tie it pretty tight to get it to stay on there, but the goal is to be able to place at least one finger or two underneath the tie. That way you know that it's not too tight around the patient's neck, and can continue to talk to them as well and make sure that they're okay, it's not too tight for them. And then I would, after I tied it, I would go ahead and take some tape and just tape it right there. And I would also put a piece of gauze underneath the knot so the knot isn't right on the patient's neck. And then I'd use the tape to secure the ties to the gauze so they're not moving around at all. So then after I've replaced my ties, I'm gonna go ahead and put a clean dressing around the site. And again, this is where you'd want another person as well, just to hold it in place, but we're gonna do our best. And you're just gonna go right around, and this dressing is a little bit big, but we would just want to make sure that it's around the skin and secured, and making sure our patient feels okay. Then we're gonna help them back to a comfortable position, and I'm gonna remove my gloves and discard those and perform hand hygiene. Take care of all the rest of the solution that's in my trays, discard anything, and then I'm going to go ahead and document the procedure.